With over 50 million Americans suffering from some form of arthritis, knee replacement is a common procedure. More than 500,000 knee replacement surgeries are done each year in the United States. Chances are you are considering this operation because you have chronic pain from knee arthritis that causes significant limitations in your everyday activities. The goal of this program is to help you understand your treatment options and to educate you about knee replacement surgery. It will provide you with information about what to typically expect before, during, and after total knee replacement, and show you how you may be able to have less pain and live a more active lifestyle. During this presentation, we will discuss the following topics: knee anatomy and arthritis, treatment options, preparations for surgery, risks and potential complications, the surgical procedure for total knee replacement, and postoperative activities. Please review this information with family and friends and write down any questions you may have. And as always, please talk to your doctor if you have any questions or concerns. The knee is a complex joint which is composed of bones, cartilage, tendons, and ligaments. In the knee, the ends of two bones, the femur on top and the tibia below, are covered by a smooth, firm coating called cartilage. The back of the patella, or kneecap, is also covered with this smooth cartilage. Cartilage allows the knee and the kneecap to move smoothly. Healthy cartilage enables you to bend your knee easily and without pain. Arthritis occurs when cartilage wears away and the joint can no longer move smoothly and without pain. The most common form of arthritis is osteoarthritis. In osteoarthritis, the cartilage degenerates due to age and wear and tear, and may be related to family history. Inflammatory diseases, such as rheumatoid arthritis, also cause loss of cartilage. Trauma, such as repeat sprains and fractures, may damage the cartilage and cause early arthritis. Patients with knee arthritis often experience pain with activities such as walking, stair climbing, and rising from a seated position. These patients also often have stiffness and reduced motion in the knee. The knee may become swollen and warm with inflammation. When cartilage wears away, it may cause a grinding sensation in the knee. When cartilage is completely worn away, one bone may rub against another and cause increased pain. Although cartilage cannot be seen on X-ray, you can see how wearing down of cartilage affects the space between the bones. In the first X-ray, note the wide, smooth space between the two bones. The space reflects healthy articular cartilage, maintaining a normal joint space. In the second X-ray, the cartilage is worn away, and the bones are touching. This is the bone-on-bone condition that occurs when cartilage is completely worn away. Moderation and modification of activity are important for reducing the symptoms of arthritis. For example, you may need to avoid stairs if climbing them causes serious discomfort. Your doctor may recommend that you stop or cut down on high-impact activities, such as running or sports that involve twisting and jumping. Because weight loss and increased muscle strength may reduce painful symptoms, staying active is important. Walking, cycling, and swimming are a few of the low-impact exercises that can help you manage your weight and improve your strength. In some cases, guidance from a physical therapist is helpful. Many people benefit from the use of heat or ice, applied in a safe manner and taking care to avoid skin damage. Individual preference for heat or ice varies. Many people also benefit from compression, such as that provided by a neoprene knee sleeve or elastic bandage around the knee. In addition, assistive devices such as braces, canes, and walkers help to support the knee and also improve safety. Medication can also be of benefit. Over-the-counter medications, that is, medications you don't need a prescription for, can reduce pain and swelling. These include acetaminophen, ibuprofen, or naproxen. If over-the-counter medication is not effective in controlling discomfort, your doctor may recommend prescription, non-steroidal medications. In addition, certain food supplements have been reported to improve arthritis pain. Be sure to talk with your doctor about all over-the-counter medications or supplements that you take. Injections may also be used to treat arthritis pain. Occasionally, cortisone is injected into the arthritic knee to help decrease painful inflammation. This measure, which can be employed 2 to 3 times a year, is temporary. The degree of relief provided and how long the effect lasts are both unpredictable. In addition to cortisone, a natural lubricating substance, hyaluronic acid, may be injected into the knee. This treatment generally involves a series of injections which diminishes pain for a variable amount of time. The effect may last several months. In general, this treatment can be repeated twice a year. When non-surgical methods are no longer effective at relieving pain, surgery may be an option. Some patients with less severe arthritis may benefit from a procedure called an osteotomy. Osteotomies are most helpful when only one area of the knee is damaged. In this operation, one of the long bones in the lower leg is cut to shift the weight off of the arthritic area of the knee. Younger, more active patients may be good candidates for osteotomy. This procedure may relieve pain for several years. However, some patients will later face knee joint replacement. Arthroscopy may be recommended for patients with mild arthritic changes in the knee in conjunction with meniscal cartilage tears. This procedure is most effective in someone with symptoms of catching and locking of the knee caused by the meniscal tears. Arthroscopy is unpredictable for relieving arthritis pain and is generally not done for pain relief alone. Osteotomy and arthroscopy are designed to allow a person to live with their arthritic natural knee. If these treatment options become ineffective, the next step may be consideration of knee joint replacement. In joint replacement surgery, the damaged areas of the knee are resurfaced with metal and plastic components. The most common knee replacement surgery is total knee replacement, in which all of the joint surfaces, femur, tibia, and patella, are replaced. People with arthritis that is limited to just one part of the knee may be candidates for unicompartmental or partial knee replacement. In this procedure, just the damaged side is replaced with metal and plastic. Before your surgery, you will spend time with your doctor discussing your specific knee problems and your goals following surgery. It is very important that you understand the benefits of surgery as well as the restrictions. For example, although most patients find that knee replacement is very successful at relieving pain, it will not allow you to do more than what you could do before you developed arthritis. Be sure to address any concerns you have with your doctor before your surgery. Write down specific questions you may have about the procedure and your recovery. It is important to understand the rehabilitation, recovery time, and special needs you may have before and after surgery. Preparing for a total knee replacement begins weeks before the actual surgical date. In general, your doctor may discuss the following with you: dental examination. Dental procedures such as extractions and periodontal work should be completed before knee replacement surgery to reduce the potential for infection. Medications. Your doctor can advise you which over-the-counter and prescription medications should not be taken before surgery. Stop smoking to reduce the risk of postoperative lung problems and improve healing. Weight loss. In patients who are overweight, losing weight will help reduce stress on the new joint. Laboratory tests, blood test, urine test, an EKG or cardiogram, and chest X-ray may be required to confirm that you are fit for surgery. Depending on your medical condition, your surgeon may recommend consultation with your family physician prior to knee replacement surgery. It is important to be in the best possible overall health to help promote recovery following surgery. Exercising before surgery can increase your muscle strength and endurance and can make it easier to follow your rehabilitation program. If you and your doctor decide that knee replacement is the best treatment option for you, you should completely understand the risks and complications associated with the procedure. Medical risks of knee replacement surgery include infection that develops in the surgical wound or deep around the prosthetic implant, blood clots involving the leg or lungs, complications from anesthesia, nerve or blood vessel injury to surrounding tissues, wound complications, postoperative bleeding, possibly requiring blood transfusion, medical complications such as pneumonia, heart attack, stroke. Other problems may occur with the implanted joint itself over the life of the patient or lifetime of the implant. Although infrequent, these problems can occur and include loosening of the knee implant where it is fixed to bone, breaking or wearing out of the implant itself, problems with the kneecap or patella, including dislocation or fracture and/or failure of that implant, swelling and continued pain and stiffness. It is important for anyone planning on a knee joint replacement to understand that an artificial knee is not a natural knee. Some people may not be able to squat or kneel as easily or as fully as they'd like. Also, your surgeon may not recommend that you do so. Before, during, and after surgery, your medical team will take many steps to avoid complications. For example, they will perform various tests to ensure you can safely undergo surgery. You will be given a medication to thin your blood to help reduce the risk of a blood clot. To prevent infection, you will be given antibiotics before the start of your surgery. This will be continued for 24 hours after your operation. To begin the surgery, your doctor will make an incision on the front of your knee. The kneecap or patella is rotated to the outside of the knee to help your doctor see the area where the implant will be placed. With the end of the thigh bone, or femur, now exposed, your doctor will use special instruments to measure and make precise cuts of the bone. The end of the femur is cut into a shape that matches the corresponding surface of the metal femoral component. This component is then attached to the prepared end of the femur. Next, the shin bone, or tibia, is prepared with a flat cut on the top. The exposed end of the bone is sized to fit the metal and plastic tibial components. The metal component is then inserted into the bone. A plastic insert, or bearing surface, is then snapped into the tibial component. The femoral component will slide on this plastic as you bend your knee. If needed, the kneecap or patella is also cut flat and fitted with a plastic patellar component. Your surgeon may choose to use cement to help fix the implants on your bone. Your doctor will conduct several tests during the surgery to ensure that the correct sized components are used and placed in alignment to ensure that the knee is balanced and moves well. Your doctor will rinse out the debris from your knee with sterile fluid and then close the wound in layers with stitches and/or staples. A drain may be placed in your knee to remove blood from the inside of the joint that can accumulate after surgery. The plastic drain is removed a day or two following surgery. When you awaken from surgery, you will be in the recovery room. Pain management after surgery is an important part of your operation and often one of the greatest concerns for patients. Pain management after surgery may be achieved by a variety of techniques, including various types of spinal anesthesia, nerve blocks, as well as injectable and oral medications. Talk to your doctor about what type of pain control will be used following your surgery. After surgery, you may be fitted with a CPM, or Continuous Passive Motion Machine. This device will automatically flex your knee while you are resting. Your surgeon will let you know whether you will be using this device, how much, and for how long. In the days following surgery, your condition and progress will continue to be closely monitored by your orthopedic surgeon, nurses, and physical therapists. Much time will be given to exercising the new joint, as well as deep breathing exercises to prevent lung congestion. Gradually, pain medication will be reduced, the IV will be removed, diet will progress to solid food, and you will become increasingly mobile. Rehabilitation is an important part of your recovery. After surgery, your physical therapist will show you how to get out of bed safely and begin walking with your walker or crutches. Your pain should be managed so you can effectively complete your post-op exercises. You will start post-operative therapy almost immediately, gradually moving from passive to active exercises. Your physical therapist will work with you on post-operative exercises. Your physical therapist will also teach you how to safely use stairs and how to get into and out of a car during the first few weeks after surgery. Length of hospital stay varies from 2 to 4 days, depending on your progress. Your doctor and physical therapist will establish discharge goals, and once those goals are met, you will be discharged. Rehabilitation will continue either at your home, an outpatient facility, or in a rehabilitation facility. A question frequently asked by patients is, how long will the knee replacement last? More than 90% of knee replacements are still successful at 15 years or more. It is important to talk to your surgeon about your desired activities before considering knee replacement. The more demand that is placed on the artificial joint, the greater the potential for wear and failure over time. Depending on your overall health, it may be okay to walk, bike, golf, and play some low-impact sports. Some activities cannot be done without causing undue wear and loosening of the new joint. Always allow extra time for airport security. Since your implant is made of metal, it may set off the metal detector at airport security. In this era of heightened surveillance, almost all security checks no longer accept a document that states that you have a metal implant in place. You should inform the screener that you have an artificial knee. Be prepared to be evaluated with a handheld detector. It is useful to wear loose-fitting clothing so that you can show your knee to the inspector if necessary. We hope that we've answered most of your questions regarding knee replacement surgery. Knee replacement can relieve pain and improve knee motion, allowing for a better quality of life in many individuals. Be sure to talk with your doctor if you have any questions or comments about the information presented in this program.